Okay, I think we are ready to start now. We've got about 160 participants with us. So once again, a very, very warm welcome to DA's very first webinar. We are really proud to present to you our webinar on the path to normalcy. So we really thank you for your time joining us this morning to learn more about, what can we expect on the road ahead. So when COVID first broke out last year, we were expecting, something like 9 months to a year-long fight, similar to what we experienced with SARS when it lasted for about 9 months. Yet, we are almost 2 years into this pandemic now, and COVID-19 is still very much alive. So the government has actually recently announced a change in strategy from being COVID-free to living with COVID-19, and shifting from basically being in a pandemic state to an endemic state. So what does this mean for all of us, and what can we expect on the path to normalcy? So that is the purpose of today's webinar, and we'll be sharing more on, what can we expect? How do we live our lives in this new normal? And today we have with us our two anchor doctors, Dr. Raymond, as well as Dr. Ying, to share more on our path to normalcy and how do we live with COVID-19. So some ground rules, in the interest of, clarity, sound clarity, and to avoid any disruptions, please keep your mics muted, but you are more than welcome to actually leave your videos on so that we can see you and interact with you. And as I mentioned earlier, if you have got a question, please feel free to post them on slido.com. You can just key in path to normalcy in a hashtag, or alternatively, I have also dropped the Slido link in the chat box. So if you have got any questions, you can just feel free to drop them in. We'll address them later on at the end of our webinar during the Q&A segment. And just for information as well, the session will be recorded, and this recording will be shared with all after the session ends. So very quickly, moving on to today's agenda. So we'll be covering 3 segments today. The first one being COVID-19, right? How do we make sense of this whole huge deluge of information that we are constantly being inundated with, from the news, social media platforms, online. We are just being bombarded with information. So how do we make sense of all of that? And number 2, much to the pleasure and happiness of all of us, VTLs were recently announced. So vaccinated travel lanes where we get to now travel quarantine free. I think this was a very, very much welcome news for all of us. And what does that mean for you, right? And how can you prepare yourself for travel in this new COVID-19 endemic state? So lastly, we will wrap off the session with a question and answer segment. That's when we will actually take questions from that you have left on Slido, and we'll be addressing them and helping to answer some of your questions. Okay, so without further ado, I would now introduce Dr. Raymond, one of our speakers for today, to share more on his segment. Dr. Raymond, please. Thank you.
Thank you, Pei-Ting, for the kind introduction. And more importantly, thank you everyone here for your time in joining us today to hear more about our path to normalcy going ahead. And I would say that despite having done quite a few talks about COVID-19, today's talk is rather different from the tone and the content of what we have done previously. And it is something that I'm very happy to actually present about, because this is one of the first times I'm able to do a talk with a more upbeat mood, something not so prophylaxis about how things are going to get worse and worse. But I think for the first time in 1.5 years, we finally can start to make sense of seeing the light at the end of the tunnel. And I think that is of course, once again, with any kind of pandemic talk, it might be a bit too early, things might change. But as it is right now, this is one of the first times that as a medical community, we are starting to see the end of the tunnel. And I think that's a big relief for a lot of us who are currently practicing. So going on, let me explain why am I able to say all this. So right now, of course, there is a sense of crisis in the country, with our caseload going up to as high as 5,000 recently. And a lot of people are asking, how can we be saying such things that we are actually opening up? Even in the past, when there were only 20, 30 cases a day, we went to full lockdown mode. So why are we now changing our stance to say that it is okay to live with COVID? What does that mean? And I think the key differentiator here, right, is the actual data, not just coming in from overseas, but our own local experiences. And the data has clearly shown that the vaccination has worked. It has been able to change COVID from that of 5 to 10% mortality kind of disease down to as low as up to 0.2% for patients who are vaccinated, fully vaccinated as a total population risk. And I think this is interesting because when the other countries open up in, say, in Europe, and I mean, America didn't exactly ever lock down, neither did any of the Western states. They went through waves and waves of not COVID, but mortality. People died in high numbers and are still dying right now. And I think it's good. I am happy to say that we have handled this situation as best as we could have tackled this, in a sense that we are one of the countries with one of the best lowest mortality rates throughout the entire world. And it is an example to the rest of the world. How can a COVID naive country open up? I wouldn't say successfully because we're not there yet, but as we are finding our path ahead and charting the path ahead for other countries who are pursuing the same COVID naive or zero COVID policy, how do they open up as well? And I think this is something that people around the world are looking at very closely and trying to see how they can then emulate the example. And I think the first and foremost is always been a high vaccination rate and continuous vaccination. So I think that's where the booster shots are coming in play as well. I mean, I know there's a lot of disappointment in the wider community in the country about the transmission. And I remember myself saying this, I think about 6 months ago, 1 year ago, that the COVID vaccine is incredible because it prevents transmission. And if you have it, you will not get the COVID virus. And well, with the new strains coming out, unfortunately, I think that was wrong. It is evident now that the COVID vaccine do not prevent transmission. It prevents severity, and that is enough. Being involved in HRP program, I have spoke to, I would say, more than 1,000 patients, of which some of them can be pretty old as well. And I would say all of them I've spoken to are doing very well at home. Most of them have no symptoms, and if any symptoms, they have mild symptoms. And I'm not talking about young people, 20, 30 years old. The patients assigned to us are those who are above 70 largely, and they're all doing very well at home. And this bonds out the evidence that the vaccine is helping us out of this rut that we are currently stuck in. And that's why we are very optimistic that as we go along this path, we are looking towards an eventual resumption of normalcy. But I have to say that normal will be defined differently. It will not be normal like as we had before COVID, but we are defining what is the new normal and moving along that pathway. I mean, these statistics that I'm showing right now, right, in the previous slides, are all available through the MOH website. But I think it makes a very, very important point about how being vaccinated has really impacted our country's experience with COVID. I mean, frankly speaking, our current rates of infection, right, is even higher per population than in the States, in India. But we do not see the same apocalyptic scenarios that we have seen in India earlier this year or in the States. We are, although a bit strained, still currently coping. I think that is in itself an achievement, given that imagine if the whole country got influenza at the same time, right? We will see the exact same thing now. And that is bonds out to the fact that we have reduced our mortality, we have reduced our morbidity with the vaccine. Morbidity means the number of patients going to ICU. And interestingly, right, even for those unvaccinated, the level of mortality and morbidity compared to the other countries is also better. That also bonds out the evidence that vaccination as a group herd immunity strategy does work. And it is important that all of us continue to vaccinate whenever it is our time to get vaccinated, meaning 3 to 6 months after your second shot. So now moving forward, they're talking about the stabilization phase restrictions. I know that we are still currently quite locked down in the sense that 2 people at workplaces, not workplaces, 2 people when you're going to for a meal, in public transport, 2 people as well. And of course, we are still adopting a work from home stance. as much as possible and frequent self-testing. However, looking at the situation, we are quietly confident that in time we will be able to lift restrictions, and that is also being borne out in our stance towards travel. We are opening our borders to allow, first and foremost, people from overseas to come into work, and that's something direly needed in terms of our construction industry, in terms of even our domestic helper industry as well. And I think that is all being rolled out in time to come. I think that's very important as well for us to actually finally have some sense of normalcy in the Singapore society. So we are confident also that at some point of time towards the end of the year, we can expect for these restrictions to be further lifted and to be able to then start to actually go back to becoming what we are as a major Southeast Asian hub, an Asian point of economy. I think it's very important. It's beyond health. It's even to the point of our survival as a country. I think that's very, very crucial. So moving forward. Okay, so I think there are some questions about how we what do we do when we don't feel well at this point of time, and there's a lot of confusion regarding to the home recovery program versus like the ART being positive and staying at home. So just to clarify here, right, the home recovery program refers to patients who are PCR positive, means that you did a swab with a clinic, you waited for 2 days, you got your results. That one is a PCR result. That's when you enter into the home recovery program officially. If you are ART positive only, it's not considered as the home recovery program. So if you are ART positive and you have no symptoms, no cough, no runny nose, no sore throat, everything's fine, you just need to stay at home for 3 days, monitor yourself, and on the 3rd day, repeat the ART again and to see if it's positive or negative. And if it's negative and you have still no symptoms, you're actually free to go about to resume back your normal life. If it's positive but you have no symptoms, then repeat the cycle again, stay at home for 3 more days and observe, and then repeat again the ART. At any point of time when you're at home and you do develop symptoms, that's when you go and see a doctor to get the PCR done and also get treatment for your initial bout of symptoms as well, and then wait for results at home. And then accordingly, you might enter the HRP program. Yeah. So that is how it works. And then at this point of time, I'll hand the time over to my colleague, Dr. Low, who will go forward to explain how the HRP program works for patients who are PCR positive. So over to Dr. Low.
Hi everyone. I'm Dr. Low. I'm one of the anchor doctors with DA. So I thank Raymond for doing that great introduction just now on how we are looking to move forward as a community, as a country out of this rut due to COVID-19. So anyway, I will present on the home recovery program, which is actually the default program for care arrangement for everyone in Singapore who is tested COVID-19 positive, except if you are partially vaccinated or unvaccinated above 50 years old, or if you are fully vaccinated and above 80 years old, or if you are a child less than 1 year old, or children aged 1 to 4 years old. So anyone from 5 to 11 years old can also be considered safe to recover at home. Yeah. Okay. Other than that, if you have severe medical conditions that assessed by your doctor that you are not suitable to stay at home, under the home recovery program, you will also get a call from a doctor, okay, to help assess you and see whether you will be transferred to a hospital, transferred to a community recovery area for recovery. Yeah. So given that currently there are so many COVID-19 cases out there, it is highly likely that some of us over these next few months will get the virus sooner or later. So if you're wondering what happens after testing positive, here is a quick rundown. So as what Dr. Raymond will say, after you visited the clinic because you have some runny nose, cough, sore throat, and you tested positive for your PCR, what will happen first is that you actually receive your result on the Health Hub. The clinic will also call you to inform you of the result. Then you will actually receive an isolation order via SMS. All this is inside the MOH centralized system. And then from this SMS, they will actually, there will be a link to a form where you can fill in your personal particulars and whether you have any long-term medical problems, whether you are immunocompromised, whether you are fully vaccinated or not. Yeah, depending on what you feel in, okay, most people, almost 90% and above, will be eligible for the home recovery program. Yeah, but let's say if you're not eligible, don't worry. Okay, we also have, I mean, Singapore has also a lot of other facilities out there, something like hospital, or I think some nursing homes recently has also been transformed into this kind of isolation facilities, where a lot of our elderly patients actually go there for isolation and get closer observation. Yeah. So the isolation period is actually 10 days for fully vaccinated people. So why 10 days? Yeah, for patients with mild to moderate COVID who are fully vaccinated, it has been shown in studies that actually the virus can no longer be found in the nose or in the fluids of the patient 10 days after symptom onset. So that is why we as a country also set this benchmark at 10 days. Yeah, but because me and Dr. Raymond has been actually very, very active on this home recovery program. Yeah, so when we talk to patients, they will always ask, are you sure that after 10 days, I wouldn't be infective anymore? Yeah, yeah. And some of these patients will be, I mean, as Singaporeans, we are very kiasu. We'll go and take our ART kit to go and swab ourselves at the end of maybe about 7 days to 10 days, just to make sure we are okay. Okay, so for the record, there's actually no need to repeat an ART or PCR at the end of 10 days before you stop your quarantine. But some people would like to do that just for their own safety or just to feel reassured. Yeah, and from many people that we have spoken to, actually usually by around day 7, day 8, the ART actually turns negative. Yeah, so but scientific evidence shows us that actually 10 days is actually enough, yeah, for isolation, except in some immunocompromised people or severely ill people who usually will be admitted to the hospital for us to observe. Yeah, next slide, please. Yeah. So coming back to vaccination, okay, this is actually a very important point that as part of this presentation, we actually want more people to get vaccinated as well. So why vaccinate? It is actually, number one, scientifically proven to protect against COVID-19 severe infection, especially with the current Delta variant that is going around. Okay, the latest stats that is shown is that it is actually 9 times more, you're 9 times more likely to die from COVID if you are unvaccinated. And ICU admissions in every 100,000 people who are vaccinated, there's only 0.5. But if you're unvaccinated, every 100,000 people, there's actually 4.3 that will develop severe disease, that will require oxygen supplementation and eventual ICU admission. Yeah, so currently under the National Vaccination Program, we have 3 vaccines that are technically considered approved under the special access route. Okay, first will be the Pfizer, second Moderna, and the third one will be Sinovac. Yeah. Other than that, actually the mRNA vaccines, okay, have shown to have a better response. So most of these mRNA vaccines, the Pfizer and the Moderna jabs are actually 2 doses in their primary course. Sinovac, on the other hand, or the upcoming Sinopharm vaccines, okay, actually they have a lower efficacy, so that's why it's recommended that the primary course is actually 3 doses in general. Okay, then the next point to note is that you should actually not mix dosages across vaccination types within a single course. Meaning your primary vaccination dose shouldn't be 1 Pfizer, 1 Sinopharm, or 1 Moderna, 1 Sinovac. Okay, if you don't have any allergic reactions to any of the vaccination, it should be the same throughout. Yeah. Some people who are, with all these VTLs that are coming up, some people who are going overseas are asking us whether they can take other travel vaccinations together with their COVID-19 vaccination booster or COVID vaccinations. So we often get questions like whether they can take influenza vaccine, whether they can take the hepatitis A vaccine and all these other travel vaccines. So the official recommendation is that after taking your COVID-19 vaccination, there should be 2 weeks or 14 days apart before you take other vaccinations. Yeah, okay. And then now with boosters coming up, so as of now, Singapore is running this booster program where it is recommended that we get booster jabs for our COVID-19 vaccination 6 months after our last dose.
Yeah.
Okay? This helps to improve improve our protection against severe symptoms. And Yeah, there's actually scientific evidence that shows that our immunity actually our immunity slowly wane after a COVID-19 infection, roughly about 3 to 6 months after the infection or the jab. And so that's why booster dose are actually very, very important. Yeah. Other than that, let's say if you have just recovered from COVID, do you still require a booster vaccination? Actually, the answer is, as of now, no. Yeah, because the COVID-19 infection actually already is working as a natural booster. So if you have recovered from COVID-19 infection, there's no need to go for further booster as of now. Yeah. Okay, then booster doses also do not have to be the same brand as your first 2 vaccination doses. So for example, if you have taken Pfizer for your primary vaccination, you can take Moderna for your next booster dose. Or if you have taken Moderna, you can also take Pfizer as your next vaccination dose. Yeah. Okay, I'll pass the mic back to Dr. Raymond, who will go through with us the rest of the slides.
I think onto a lighter note will be what's going to happen in the next couple of months. We can now travel, and I think people are starting to get out of the country, and I think that's very exciting. So moving forward, so before I go on, right, I would caveat that the rules for travel is they do evolve rapidly. So before any actual travel, do spend 3 days before travel. Please check online again. One of the best source of information is the SIA website itself that actually regularly updates what are the requirements of testing and travel when going overseas. So do check. So whatever we have right here is up to date as of today, right? There are things that, of course, even as country, as we open up, a lot of the regulations are dependent on our other partner countries as well. So even if Singapore's stance is as such, we have to coordinate with our fellow other countries as well in terms of all these regulatory changes. So in terms of what is the requirement for the vaccinated travel lanes, definitely you need to be vaccinated. And your last vaccine has to be at least 2 weeks before the travel. And it needs to be a VTL flight. You need to take 2 PCR tests pre-departure and on arrival in Singapore. But that is also evolving as well. For some countries, it's actually just ART before travel. And finally, you have to remain in Singapore or VTL destination for at least 14 days before the departure. So these are the current regulations that exist. We do expect as time goes by, the requirements will get lifted and it becomes more and more easy to travel. And that's the whole point of actually going back to normalcy. So moving forward. So these are the list of countries. It's not exhaustive. We expect more countries to be added over time. At this right now, countries that only require ART for travel will be Italy, as well as the United States. Other countries for now still require PCR. And with PCR testing, you always advise to at least cater 24 to 48 hours pre-travel to get the ART, the PCR done. And of course, definitely self-administered ART or PCR is not accepted for Singapore. As a validated test. So you can see there are a lot of countries who are being added to this list. And not to worry, although we are having more cases, most countries have accepted that with vaccination and with a valid PCR test, they are agreeable to have us in Singapore. So once again, this is actually quite a wordy slide. We have a lot of all the requirements as per country on this slide. So I will not go through because the information is all there. And this is something also can be found on the SIA website. So once again, before you travel, always ensure you pack adequate supplies. For example, ART kits, especially when you go overseas, there's still a lot of cases around. Do make sure that you have access to healthcare, especially nowadays we do have more COVID cases around the world. Of course, do buy your travel insurance. And then once again, avoid crowded places and always stay safe. I think that's important. I think one thing that is has been recommended also, can try the beta-histidine spray. Really helps protect yourself when you go out into a more crowded environment as well. So moving forward. So, in terms of preparing for travel, we also have some things. We're able to assist in the pre-departure testing, as well as the ART testing included. And of course, aside from your COVID vaccinations, do ensure that you are travel vaccinated as well, in order not to fall sick overseas, because it can be really, really troublesome. And with that, I'll hand the time back to my colleague Pei Ting, who will run through with you some of the services that we have been very proud to launch to support our country's opening up. So I think that's something that we work on very hard to ensure there's a smooth experience for everybody. So over to Pei Ting. Thank you.
Thanks so much, Dr. Raymond. Okay, so yes, like Dr. Raymond mentioned, DA is actually really proud to support, these new changes in our opening up. And okay, I have to apologize. At my end, it might be a little noisy because there's some reno works going on, but I hope you can still hear me well. Okay, yeah. So these services like pre-departure tests, COVID-19 vaccination certification, flu vaccine, as well as ART, including health screenings, these are all available at our 8 DA clinics island-wide. So we are really proud to be able to support your travel needs. And please feel free, just browse our dranywhere.com website to have a look and also make your appointments for all these services that you require. We also do have a mobile medical services team to actually meet your needs. So if you prefer for your pre-departure to be done in the comfort of your home, you're actually able to do that as well. You can make the appointment on our website. Okay, so moving forward, this is also to let you know that Sinopharm vaccine is now available at our DA clinics. So this is something that we are really proud of. We managed to actually procure supplies of this vaccine, and it's now available for anyone who is actually wishing to have the Sinopharm vaccine. So you can have a look at the details. It's 45 per dose, efficacy rate of 79%, which is actually high as compared to some of the other non-mRNA vaccines. Okay, and it's suitable for people with who are 18 years and above without any history of severe allergic reaction, and also have recovered from COVID-19 before and have been fully vaccinated against COVID-19 as a booster shot. These are all, if you meet any of these criteria, you would be suitable for the Sinopharm vaccine at our DA clinic. Okay. All right, so very quickly, we are very aware of the time that we have. We have got about 15 minutes to actually take on questions. Thank you so much for all of your contributions on Slido. We do see them coming in, and in the interest of time, we may or may not be able to take all these questions, but I can assure you that we will do our best to cover as much as possible. Okay, so we have actually singled out a few questions that we feel might be more relevant and more people might be actually interested to know. So the first one would be regarding the safety of vaccines, right? I think this has weighed on many people's minds. So are the vaccines rushed on the development instead of the standard timeline? How safe and effective actually are these vaccines? So could Dr. Raymond or Dr. Ying, maybe you want to take this question?
So to weigh in on the safety of the vaccines, definitely in terms of time to development, it is really, really fast compared to the usual vaccine timelines. But I'd like to share that the mRNA technology has already been in development for up to a decade before it was pivoted for use in vaccination development for COVID. Previously, they were actually using it for detection of early cancer strains. So that technology has really been developed for a long time as well. The other thing is about clinical trials. This is one of the vaccines that we have a lot of extensive human trials done prior to vaccine launch, and you have a large and mass body of data to show that the vaccine is relatively safe. I will not say that it's 100% safe, nobody gets side effects, no one dies from vaccine. That is impossible for any drug. However, I'd like to let everyone know that according to a lot of controlled studies, almost all the vaccines that we have bought in Singapore have a very, very high safety profile, and definitely the benefit outweigh the side effects. So a lot of the things that you read online in social media, I have the caveat to say that when you vaccinate an entire population, 300 million people, 20 million people do get different disease or issues on a day-to-day basis with or without the vaccine. So whether or not any adverse or poor outcomes is due to the vaccine, a lot of times might not be the case as well. So I would encourage everyone to really, there's a lot of data out there online. I mean, of course, do look through at official sources and do read, and also be confident that the vaccine is safe. Thank you.
Thank you, Dr. Raymond. So I hope whoever who posted that question, your question was answered. The next question that we have since the vaccines are unable to prevent spreading of COVID-19, does it mean that we are not immune to the virus? And do we need to periodically vaccinate in the long run?
Maybe I can take this question. Okay, so the COVID-19 vaccination initially was designed for the previous COVID-19 when the Delta variant was still not out yet. Okay, at that point in time when they did the clinical studies, actually it helped to prevent transmission. But as this virus being very, very smart particles out there, they actually mutate according to what we have tried to defend ourselves against. And then they mutate into this thing rather scary called Delta variant, okay? And somehow this Delta variant can penetrate our protection from vaccines per se, and then it can actually still transmit to others, okay, despite us being vaccinated. However, it does not mean that we are not immune to the virus, okay? The vaccination actually still protects against severe diseases, okay? So for a lot of patients who have been vaccinated, okay, we see that their symptoms are actually very, very, very mild. Almost 98% of the time, the symptoms are mild. Okay, maybe I just share a bit of my own experience because I as part of my work with DA, I also do a little bit of take care of nursing home patients. Yeah, so I know in the news you have seen that recently there are some nursing homes that have been having outbreak and all that. So the nursing home that I work with actually has all the residents fully vaccinated, and recently they really got an outbreak. Okay, but we are prepared because they are all vaccinated, and I mean, it just shows that actually all my patients have good outcomes. So none of them actually passed away. A lot of them are old patients. A lot of them are patients with previous strokes, heart attacks, chronic diseases, and all that. Yeah. So I think to answer that question is that vaccinations are still very, very useful. Okay. And then it still protects us. Yeah.
Thank you, Dr. Ying Tai. So I think we adequately covered the topic on safety of vaccines. We will now move on to asking about, kids, right? I think some of you who are parents here, you might be concerned about whether your children is eligible for the vaccine. So some of the questions that we got: can my daughter who is 12 take the Sinopharm vaccine? And is it actually recommended for kids to travel overseas at this point in time? Yeah, so
just maybe to weigh in on Sinopharm for kids, I think the approval for use for Sinopharm for children under age of 18 has not really been borne out yet. So I think it's good to just hold on to that first and await further data on whether or not it is safe. But I would say that for the Pfizer, it is been approved for 12 years and above, and the data does show that it's pretty safe. So and definitely much more protection. So I strongly recommend that in the meantime, right, do get the Pfizer vaccine instead. Then of course, the thing about kids between the age of say 2 years old to 12, probability of severe disease is actually fairly low. We have experiences managing pediatric cases, and out of the thousands and thousands we have seen so far, we have not met anyone with a severe initial outcome. So I think that is something to take heart at, that for most kids, actually COVID doesn't really affect them very much. So I think that's one of the silver linings, even though not being able to vaccinate them. We understand that in the States, it has already been approved for use on kids between 5 to 12 years old. But once again, our own health authorities will need to examine the data before we actually start the usage in a younger age group. Yeah.
Thanks very much, Dr. Raymond, for answering that question. Going forward, I think a lot of you are asking about, mixing of vaccines. Is it safe? What's recommended? Both in the chat box here as well as on Slido. So if I could just summarize that theme, what are the advantages or disadvantages of mixing between the vaccines? Can we mix different boosters from first to second dosage? And what are the issues in mixing mRNA vaccines with Sinopharm?
Okay.
Yeah. So maybe one of you. Thanks, Dr. Ying Tai.
No problem. I think this question is very, very common, and a lot of my patients are also asking the same questions about it. Okay, but for the record, for the primary series, okay, for the primary series, we should not be mixing any vaccines. Okay, so for example, if your first dose is Pfizer, your second dose should be Pfizer. If your first dose is Sinovac, your second and third dose should be Sinovac. Okay, the idea of mixing only comes in as a booster dose. Okay, as a booster dose. Okay, so it is recommended that if you have had 2 doses of Sinovac or Sinopharm before, okay, you can actually take a booster, an mRNA booster like Pfizer or Moderna to bump up your immunity even more. Okay, yeah. Or let's say if you want to mix vaccines in the primary dose, it must be because you have a certain medical condition that prevents you from taking the same vaccine. So for example, if you have taken the first dose of Pfizer vaccine and you develop a severe allergy reaction, eye swollen, mouth swollen, cannot breathe and all this, okay, you should not take the Pfizer or Moderna vaccine again. So you have to transition to the Sinovac or Sinopharm vaccine to complete the vaccination. Yeah, okay. Booster doses wise, okay, it is okay to mix vaccines in a sense that Pfizer, you can take Moderna. Moderna, you can take Pfizer. Okay, but as of now, it is still recommended that all booster doses be of mRNA nature. Okay, because it is really the most efficacious. It produces the most antibodies and also produces the most amount of protection against COVID-19. Yeah, I hope that answered your question.
Thank you, Dr. Ying. So the next question that we have is, what are some key pre-existing chronic diseases that will be particularly impacted by COVID-19? So for example, asthma, hypertension, etc. I think probably...
I'd like to share that most commonly we get asked if I have like high blood pressure, diabetes, cholesterol, am I at higher risk? Is it dangerous? I mean, of course, having diabetes can increase your risk, but from what we see in the community, most patients, even with diabetes, are actually doing very, very well. So only really severe diseases such as having cancer and being on active chemotherapy can increase your risk of having a bad outcome. Other things will be like having any severe diseases like ischemic heart disease, heart failure, or any like kidney issues up to the point of requiring dialysis. These are the ones who actually tend to have poorer outcomes. And our experience, in fact, the only really prognostic factor for poor outcomes, right, is actually really the lack of vaccination. We have seen patients who are on dialysis, we have seen patients who have recent heart stenting, and they are perfectly fine. So once again, emphasizes the point. I know it sounds a bit more like a MOH health warning, but it's true. We've seen it so many times already. And even one of my colleagues, I'm sad to say, wasn't vaccinated and actually really had a very bad outcome. And I think from the bottom of our heart, we really would like none of our fellow Singaporeans to actually have to go through that. So once again, vaccination seems to be the key factor in determining of poor outcomes. Yeah.
Thank you very much, Dr. Raymond, for taking this question. So moving along, the next question, what is the advised timeline between being vaccinated and taking antibodies test?
Just to clarify this question, because the purpose of antibody test can be for travel overseas or just to make sure that you are adequately vaccinated. So of course, to get a proper antibody response, we normally wait about 2 weeks post-vaccination. Of course, if you are doing the antibody test to verify that you have adequate protection, just to once again clarify, studies have shown that the amount of antibodies you have in your body does not exactly correlate to how much protection you have. So it's more of a yes or no as compared to is it a lot equals to very well protected. So that is the current state where we are in right now. Yeah.
Thank you, Dr. Raymond. Okay, so going back to the question on kids, I think there are some parents here who are quite concerned. Is it actually safe for kids to be traveling at this time? Should families go out on vacations at this period? And what precautions or measures should we take? Should a family take when traveling?
Okay, so actually, I know that kids currently are still unvaccinated, okay, but as what Dr. Raymond has shared just now, actually, if kids actually get the COVID-19 infection, really most of the time is very mild infection. They'll usually come down with a little bit of fever, runny nose, sore throat, which will actually get better in about 3 to 4 days. Okay. But actually, if you ask me whether kids should be traveling at this juncture, okay, unvaccinated, okay, I would say personal recommendation is that maybe just wait a little while longer, okay, mainly because the places that we are having vaccination travel lanes with, some of them actually have to be in the community, yeah, okay, and as of now, we know that kids will recover. We know that kids will recover, okay, but we don't exactly have scientific evidence to show whether there are any long-term effects. So sometimes it has been shown before that last time that some people who get COVID vaccination will lose their sense of smell, lose their sense of taste for a while. Okay, but as of now, we know that it's actually sometimes even up to 5-6 months, but they will come back. Okay, whether there are long-term effects, maybe after 10 years, after 20 years, we don't know. So of course, from a prevention of disease point of view, it's better to prevent than to cure. So maybe without the vaccine, we can delay the travel maybe just for a few more months and see in future whether we will be approving other vaccines for children. And if that is so, then they can go travel.
Thank you very much, Dr. Ying. So I think in the interest of time, we will just have one last question before we round off the session. So this is, what are the differences between foreign non-SG approved vaccinations and SG approved vaccinations? Do we need to vaccinate against SG approved vaccines after being vaccinated by other brands overseas?
So just to highlight the key difference between the ones that Singapore government has approved versus the ones that are still external to the market, is basically have they been through the HSA clearance process. Scientifically, they still fall under the different categories of mRNA vaccine, inactivated vaccines, whole vaccines, quite a few categories. So of course, when we are assessing vaccines, right, if the effect is roughly the same, side effect profile is roughly the same, it doesn't make sense for the Singapore government to assess every single vaccine on the market, because there's also the part about procurement where we try to do bulk purchase and then of course get a better price as well. So that's actually more on a regulatory difference as compared to a scientific difference. Of course, every vaccine, when it comes to efficacy profile as well as side effect profile, there are some differences. So to answer the question, we will need to know which one you're comparing against which other one to then highlight the specific differences between the vaccines. Yeah.
Thank you very much, Dr. Raymond. So I'm aware we are now at 12 noon, which is when the webinar was supposed to end. So we have done our very best to cover as many questions as we could, especially within the larger teams. But in the event that, we were unfortunately not able to answer your questions, we do apologize. And please feel free to actually download our DA app, and you can actually have a teleconsult with our doctors if you've got further questions or, concerns regarding the vaccine or anything relating to COVID-19. Okay, so but not to worry also, I think I saw a few questions in the chat box asking if this recording will be shared. Yes, definitely, this recording will be shared with attendees after the event. It will reach you via your email so that you can, play back and watch if you've missed out any parts during the webinar. So once again, a very, very huge thank you to everyone for joining in. I trust that, you have learned something from the session today. And I would like to thank Dr. Raymond and Dr. Ying for your time as well. Yeah, and I hope all of you have a good lunch and also have a great break over tomorrow's Deepavali holiday. So thank you very much. And we hope to, organize the next webinar soon, and we can have you guys join in the session again. Yeah, thank you.